Good morning, Dr. Hill. How are you today?
Good morning. I'm well. How are you?
I'm very well. It's a pleasure to have you here today. It is my understanding that you are a cardiac surgeon, passionate about improving the healthcare system, diversity and inclusion in medicine and physician wellness. Can you begin by introducing yourself a little bit and share a bit of your extensive experience as a physician in this fine province?
Absolutely. So, as you said, I'm a cardiac surgeon. I work out of two hospitals downtown Toronto, and I have extensive passions. Some of them are, of course, around cardiac surgery. I couldn't be happier with my chosen career. But I also do believe strongly in the need to improve things where we can and to take care of the world. And for me, that has really centered over the years around things like climate control, or climate change, rather, sorry, but also has really focused on how we take care of each other. And that's what led me in reality to pursuing this role as president of the Ontario Medical Association, which I've had for the last year, has been around the idea that I firmly believe physicians take great care of their patients for the most part. But they can only be able to do that, they are only empowered to do that if someone is making sure that they are taken care of as well. And so when I pursued this role, when I ran for this role, my idea really was that by helping physicians, I could help all of Ontarians. And this has been a really amazing year to have that opportunity.
Absolutely. Given the breadth of your representation as president of OMA, how have your responsibilities evolved in terms of your duties to the 32,000 working physicians?
Thank you so much for asking that question. So it has been quite the year to be president of the OMA. In addition to all of our normal activities around conversations with the government, negotiations, membership engagement, we've also had to deal with a pandemic, of course.
Yes.
And that pandemic has changed a variety of things across the field, including how we interact with our members and how we interact with our patients. So when I took this role on, we had all agreed that amongst the priorities I wanted to pursue and really drive included externally membership wellness, as you've referenced, or ensuring that physicians are well enough to do their work, and equity, diversity, and inclusion. And so for EDI, as we shorten it, it's really internal and external. We know that across Ontario and really across most of the world, unfortunately, different groupings of people experience life and healthcare differently. And that is true within the profession with opportunities for advancement and mentorship, but it's also unfortunately true often in your access to healthcare. And so one of my big priorities was to try and drive us to acknowledge this, take it to the forefront of the conversation, and then start working on it. Because first you need to convince the entire population or left of the population that this is an issue, and then you can start solving it. So one of the things we've done over my time as president has been to really take a closer look at the gender pay inequality amongst the profession and the very complex reasons why these exist. And that's a really interesting question because Ontario physicians, for the most part, get paid fee for service, which is a schedule of benefits deal. And it means if you do an act, you get paid a certain amount. And so for the most part, people would think that that is gender neutral. But it turns out that when you look at the data that we have about how people bill and what they bill, and you control for all of the obvious things like how many days a year you work and what specialty you're in, there is a consistent difference between what men and women physicians are able to bill and what they are able to generate as revenue. And a lot of that plays out into whether men or women go into procedural or cognitive specialties and how long they spend with their individual patients.
Okay.
So we've looked at that very extensively, and we're starting to drive forward recommendations on how to address that and how to improve it. And I think that will have a real benefit for patient care.
What an extremely intelligent and interesting view. And man, I'm just very pleased to be here with you today and have this conversation. And I want to ask you, now we've talked about the physician side, but how does this change the landscape of the healthcare provision? How has COVID-19 done this? And then I have another question for you with specific to the way you have to conduct with your, or the way you have to interact with your patients as well. But first, if you could just talk about how you would say COVID-19 has changed the landscape of healthcare provision.
Absolutely. So the biggest issue around COVID-19 has been transitioning to deliver a lot of our care virtually. And patients and physicians alike have loved the opportunity to deliver care when it's reasonable by telephone or by Zoom calls or any other form of virtual networking. But it has provided some real challenges for both.
Yeah.
being able to navigate and being able to make an assessment, a diagnosis, and a treatment plan without being able to lay hands on patient, without being able to do that physical exam, without being able to, when you're counseling, reach across and hold someone's hand if you're providing bad news, has been a real challenge. And it's been something that we at the OMA have wanted to embrace for a long time because we know. We know that for patients, the ability to take time off during the day, to go and drive to your doctor's office, to wait at your doctor's office for what is often a very short period, and then drive back. Many people miss a whole day of work for this.
Yeah.
And it is, again, back to the EDI issues, it's just unfair and it makes care differently accessible. So if we can provide healthy care, if we can provide competent care, if we can provide excellent care virtually, that's something we really wanted to do. And we've been able to make leaps and bounds progress on this that we couldn't have made otherwise, despite wanting to, because the pandemic made it necessary. And so once it became necessary, we were able to align with the government on goals and ensure that we could actually do this for patients. And so that's been amazing.
Yeah, absolutely.
Yeah. Sorry, the downside
That's okay.
of COVID-19 has been the real division along socioeconomic lines and along racial lines, unfortunately. And so we have seen very clearly something that every medical student knows, which is the biggest determinant of your health is actually socioeconomic classes and socioeconomic factors. And we've seen that across the board. We've seen that poorer regions have more sick people from COVID, have more deaths from COVID. And that has really empowered physicians to raise their voice in outcry. And at the OMA, we have lobbied for things like essential sick pay leave so that people can stay home protecting themselves and others. And we've also lobbied for targeted vaccination and targeted care in these hotspots. And I think that we've managed to move the dial on that a little bit, which has real implications for the future of healthcare as well.
Okay, Dr. Hill, I think I could spend all day talking to you. I know you don't have the time for that, but I just will say one more thing to your point. Here in Northern Ontario, and I am from Southern Ontario, but here in Northern Ontario, there's a serious lack of physicians, which we've been pushed to more of the virtual type of accommodations. It does work well for me and my family, but what you've been doing as president and how you are able to still continue as a strong mother as well. Let's not forget that, as well as going to work and being phenomenal in your position as a cardiac care physician. I just want to thank you for your time today. Thank you for what you have done for the province. Thank you for being there for both the patients and the physicians. I wish you well, and I hope that you continue to be safe as you obviously are with your mask on. And thank you again for today.
Thank you so much. And to everyone listening, please do go out and get vaccinated as soon as you can. There's been a lot of mixed media about it, but it is the single most important thing you can do to protect yourself, protect others, and get us all back to something that is more like a normal.
Thank you so much. Have a great day.
You too. Bye.